patient or an employee, what's the most insane thing you've seen or experienced in a hospital? Story 1. I was a patient. There was an elderly man in the bed next to me waiting to be transferred to a nursing home. The nursing staff treated him as though he was a difficult patient when, in reality, he was just too frail to do things for himself. Anyway, one day, the nurse refused to help him go to the bathroom as she said he was just being lazy. I could not help as I was bedridden myself at the time. He took a fall and hit his head on the floor. The male nurse just threw him back onto the bed. His family arrived, and I heard them asking the female nurse who refused to help him why their father was so groggy. The nurse lied, saying nothing had happened and he was fine. I called the man's daughter over to my bed and told her the whole story. Needless to say, the hit the fan. Story 2. I was in the hospital for an infection in the bones of my foot. I take medication for a heart condition and diabetes. Nurse came in one evening to give me my medication. She brings me strange-looking pills. I ask her what they are. She tells me 2 medications I've never heard of. I tell her she might have mixed up my medication with someone else's. She says no, she's sure, take the pills. I refuse. I ask for the head nurse for the floor or a doctor. Head nurse comes in. I ask her what medication I'm supposed to be receiving. She checks my chart, confirms what I'm supposed to be taking. I ask her to ask the original nurse what medication she has in her hand. The nurses leave the room and a third nurse comes back in with the right pills. Head nurse comes back in and tells me that the original nurse will no longer be responsible for my care. The next day, the nurse coordinator comes in with a digital audio recorder and notepad to go over all the details of what happened the night before. From what I learned later, this wasn't the first incident with this nurse giving out the wrong medications. She had done it to a couple of other patients, and I heard she had been suspended pending an investigation. Don't know what happened because nobody ever contacted me after that. Story 3. One guy in the emergency room waiting area was arrested for masturbating in front of kids, and while he was getting arrested, another guy started masturbating in front of some young woman. Fucking insane. Story 4. I'm a nurse. We had one guy with a history of severe, untreated hernias who was admitted because one had grown so large it looked like he had a basketball under his skin and he needed surgery. Well, before we had the chance to get him to the OR, he sneezed, and the stretched skin of his belly just split open like a water balloon and his intestines tumbled out. It looked like he'd dropped a plate of spaghetti in his lap. We draped some wet gauze over the area and rushed him downstairs pretty sharpish. Story 5. I was a patient in A&E and a young guy came in drunk as all fuckery and he had ripped his sack open trying to jump a bollard. Well, when he saw the needle the nurse had to use to numb his franken beans, old mate was not having it. Cue what was almost like a horror version of a Scooby-Doo chase scene with flappy sack guy running in and out of rooms sans pants while getting chased by a bunch of security and nurses. They finally caught him, and he promptly passed out so they continued his care while he was snoring away. I was just sat in my hospital bed trying not to laugh too hard and pop my stitches while messaging my mum like, "You are not going to believe what I just watched." Story 6. Editing for popularity. Thanks for all the internet points. Also, please don't put this on Subway Surfer. I'm a third-party contract cleaner at my local hospital. We basically clean all the public spaces and non-patient areas. The morgue falls under us. Well, like many morgue, we have a walk-in fridge. Well, one morning, as a supervisor was walking past, there happened to be water on the floor coming out of the morgue. It turns out a cooling pipe was leaking pretty bad. So we call the maintenance and repair people and get the water shut off to that area. There was about 2 inches of water throughout, so we cleaned that up. And because the cooling pipe broke, we had to open the fridge and transfer the bodies to the second spare fridge away from the broken pipes, so the funeral people could come and pick them up without going around ladders and construction. We crack open the door to the watertight fridge, and because it was watertight, we didn't know that a second pipe had also broken. Turned out the fridge had flooded as well. Have you ever seen a video of someone cutting a pool and the water running out, as well as everything that was in the pool? Well, the water was so high that the bodies were floating, and we had that sliced pool effect as soon as that seal was broken and the door was unlocked. So not only was 5 ft of water rushing out of the fridge into the morgue and into the hallway, but whatever was floating in that water did as well. There were sheets and gowned bodies that ended up all over the floor, and one actually made it into the hallway. The basement was flooded once again, and that was one of a cleanup. Whenever someone says the word floaters to me, that's all I can think of. This happened a few years back before COVID. I almost quit that day. Story 7. I'm a nurse. Seen some weird stuff, but the one that sticks out is an 80-year-old manic-depressive woman blocking my way out of her room to twerk at me. Story 8. While in the emergency room for an asthma attack as a child, two teenage boys were brought in by ambulance. They had been huffing silver paint. At first, I thought it was funny because they looked stupid with the paint on their faces. Then my mom started crying hard. The older of the two was DOA, and the younger was screaming, "I can't believe I'm going to die," over and over. I can still hear his voice in my head 35 years later. Even worse is their parents' sobs when they showed a little later. It turned out they were brothers. Fucking awful. Story 9. Quite a few things. First, patient in severe alcohol withdrawal busted out of 4-point locked restraints somehow. Super Hulk strength. His 101 safety companion came running down the hallway past the nursing station yelling, "Call security! Call security!" And here comes this guy butt naked, blood flying everywhere because he ripped his IVs out, carrying an IV pole above his head. Security took him down, we sedated him, and basically intubated him on the floor of the unit. An elderly lady, maybe 100 pounds soaking wet, had severely low oxygen levels. We didn't have ventilators available, COVID, and the doctors were trying to delay intubating her as long as they could, supporting her respiratory system with a non-invasive BiPAP machine. She was so confused from her messed up blood gases, she busted out of restraints, picked up a chair in her room, threw it at the window, shattered it, and tried to jump out the window from the 9th floor. We had to bear hug her and bring her down to the floor. She was intubated. We had to manually bag her while someone drove to a sister hospital, picked up a ventilator, and brought it for her. Patient who was shot in the abdomen was refusing an NG tube for decompression of his stomach. Tube goes through your nose into your stomach, hooked up to intermittent suction to keep stomach acid and gas from passing into your bowels. Without it, if you have an obstruction or ileus, your abdomen swells in size and things like surgical incisions can rip open. Well, he was completely refusing it, and we warning him his incision would rip open. Sure enough, it eventually did. His intestines spilled out onto his lap and he just sat there poking them. Completely fascinated, he was seeing his own intestines. I had to tell him to stop touching them, and he said, "Why?" And my response was, "They live inside of you because they're not meant to be touched. Stop touching them." He was rushed to the OR. Story 10. Had a C-section after 32 hours of labor. I passed out from exhaustion, slept through all but about the last 10 minutes of the surgery, finally woke up to the doctors trying to figure out the name of the big guy with the weird face in Goonies. I answered sloth, they thanked me, and went on delivering my daughter. Story 11. I went to visit a mental health client who'd unsuccessfully tried to end it by severing the major vein and artery on both sides of the neck. This was nothing compared to the guy next to him. A guy working for some cowboy air conditioning company was not given proper equipment and has literally cooked off his arms and legs. He was completely helpless. Still in fresh bandages, he had the most beautiful, caring wife spoon-feeding him. His eyes were glossy as he saw me looking over at him. I gave a chocolate bar to his wife and nodded at him. After this, I told my client that I needed a second, and I went out in the hallway and cried like a baby. Story 12. I was an employee at the ICU. A man had tried gunning down his wife, who was divorcing him. She managed to flee, so he drank concrete dissolver to commit suicide. That stuff is water reactive, and all of the medicine we could give him were water-based. So, basically, there was nothing we could do at all but watch him and monitor the situation. The chemical burns were intense and you could see all the way inside. He didn't live the night. He was comatose, of course. Still, there were police officers keeping guard the whole night, and the guy was in handcuff. Not that he was going anywhere. I've seen worse, but that was pretty hardcore. Story 13. I was brought to the ER by ambulance. While I was waiting for a room, another patient was extremely drunk and waiting for a bed nearby. He asked the EMT if he could vape in the hospital, and they told him he couldn't. He proceeded to pull out a vape and try anyways. The hospital staff took it away from him. After about 5 minutes, and when he seemed sure that nobody was looking, he pulled out another vape and tried to take a hit. It was quickly confiscated by hospital staff. Story 14. A rogue, wandering cat behind the counter of the closed-for-the-evening hospital shop. There's a set of shelves built into the wall behind the counter that's full of teddy bears and other soft toys, presumably to be bought when visiting a patient. and the cat was asleep amongst the toys. Story 15. I work on a psych ward. I see fucked up every day. Yesterday, I had to take away my patient's wallet because he wanted to order a wedding ring for his future wife Kim Kardashian. Later on, he used his poo to write M+K on the wall. If you are reading this, Kim, you won't find another guy like him. Story 16. This drove me insane. I had a broken wrist and leg and had just had surgery, so I couldn't go anywhere, confined to bed, and had just got a new roommate. It was an old man who was affected by dementia, I believe, poor guy. His wife came in with a small boombox, which was strange. She immediately set it up and started blaring what sounded like Chinese communist anthems, and were later confirmed to me to be exactly that. These were played on loud, 24/7, to comfort him. All we had was a thin curtain separating us, and it was the same 2 or 3 songs on repeat, so by gods did it get old quick. That's not all, though. He'd repeatedly yell for help every few minutes, as though his life depended on it. I understand this was partially an effect of the dementia, and partially because he spoke no English, and the nurses couldn't communicate to him, so he couldn't understand what was happening. But that also got old fast, and he was worse at night. He'd eventually settle down for a few hours, but even if he slept, I still had to put up with the communist anthems. All the nurses kept apologizing to me. I'd been getting on really well with all of them. They did their best to let me chill, as they knew I was on edge. They knew my moods pretty well. After almost 5 days of this, finally a free room opened up. It was supposed to go to a new patient coming in, but the nurses refused and made sure the room was given to me instead, and the new guy got my room. I was literally going insane and becoming very nasty. Not to anyone, but in my compassion for this guy and his situation. I'd yell and mock the songs. When he'd call for help, I'd yell back to shut up. It was totally out of line and totally not me. The lack of sleep and peace to recover was getting to me. Anyway, I got the other room with this lovely old guy who, despite being rooms away, had heard the cries for help and music and had been wondering what was going on. I made him keep the door closed so we had our own little oasis of peace and quiet, and luckily he was fine with it. He was a complete gent, and we got along great, despite a huge age gap. The nurses would update me and tell me they were doing what they could for the new guy, as he wasn't coping well either. But at least he was mobile, so he could leave the room when it got too much for him. And that's why I never want to hear another Chinese communist anthem ever again as long as I live. Story 17. I work in psychiatric care. A woman masturbated in front of me, with a carrot she stole from the kitchen, while I went on about my day, documenting, etc. Story 18. UK patient in an A&E waiting room. Fellow was sat in the waiting room bleeding from somewhere, not a small amount either, completely oblivious to everyone around him, including the nurses trying to admit him. Pretty sure he was on ecstasy as he just sat there gurning and bopping to some music on his headphones. Strange experience to say the least. Story 19. I was working in a hospital and we had a prisoner in the emergency department. We were out of beds, so they had him in a storage closest with 2 guards. I went in to examine him. He had a port for dialysis with an attached tube. He was probably 6'3", 350 pounds. He's cuffed. As I'm examining him, he bites and tears out his tube and blood just starts spraying. I'm everywhere, all over me and the guards. The guards were in shock and I was in shock, and we were all looking at each other expecting each to do something. Eventually, they restrained him and we sedated him and stopped the bleeding. It was at like 2 a.m. and just an unreal experience. Story 20. I spent 3 months in hospital when I was 18 In that time on the ward, there were definitely some characters. A month or so in, I guess they were out of room in other wards, but around 9 o'clock at night, a man was brought in by a police officer and clearly off his face. He was assigned a bed, left alone, and I guess passed out for a bit. Middle of the night, I hear a shuffling around and wake up. The guy is stood at the foot of my bed, and when he notices I'm awake, starts yelling about how I'm on fire. Everyone is going to die and tries grabbing at other patients to save them. Security were called, police were called, he was aggressive, belligerent, and even when they got the cuffs on, he was giving his best fight to escape or hurt someone. Dunno if it was desperation, fear, reflex, or what, but one of the nurses just yelled that they were going to call his mother. Instant attitude shift, calmed down, apologized, and started crying. He was escorted off the ward and I never saw him again. A truly bizarre 4-hour stint in a pretty weird stay. Story 21 posted this in another thread before. Weekend afternoon, one of the first nice days of spring. Slow day in the ER for the most part, when in comes a distressed younger couple with their infant baby. Mom is hysterical, and dad is barely keeping it together. Dad gets it out that baby is bleeding from his mouth. I'm skeptical, because the baby looks quite happy, but I do see a slight reddish-pink tinge inside his mouth. I take the child and put him down on the exam table, all bright lights and tongue depressors to get a good look in the baby's mouth. Sure enough, evidence of blood, but again, no baby distress. Oh wait, there's something near the back of her mouth, kind of a darkish red color. A blood clot maybe? Not sure. Have a coworker firmly immobilize the head, and with hemostats, go in and pluck out the object. Amazingly, it comes out in one piece and looks like a plump, slightly larger-sized raisin. I can't figure out what it is, but it's definitely not a clot. Into the specimen bag goes the squishy thing. No distress for the baby, vitals normal, breathing easily, happy demeanor, good color, etc. Time to get more of a history from mom and dad. First day outside with new baby and their dog, enjoying the weather. Baby's on a blanket, giggling as the dog runs around him. Wait a sec, did you say? A dog? Let me take a closer look at the thing in the specimen bag. Sure enough, suspicions confirmed. It's a tick. Deflated to be sure, but a tick that recently had a large meal of the red stuff. Baby must have pulled it off the dog and then done what babies do by putting it in his mouth. TLDR. Infant pulled a full tick off a family dog and chewed it. Story 22. A Vietnam veteran collapsed on the floor of a VA hospital waiting room and having an acute crisis while VA staff pretended they couldn't see it happening. It looked like he was having a heart attack and he was screaming for help, and the VA employees just rolled their eyes and avoided getting involved. They acted like he was a toddler throwing a tantrum. He was alone, scared, and in pain while experiencing a medical crisis in a hospital, while the staff acted like he was a burden. Multiple patients jumped up and helped him while yelling for assistance as soon as it started happening, and stayed with him until I think someone called 911, and then the VA medical staff decided to finally assist because they didn't want to deal with that paperwork. According to one nurse that watched the whole thing, I don't know what happened or if he was even in danger, but the behavior of the staff clearly showed how little they think of all the veterans looking to them for help and medical treatment. I will never trust a VA hospital or staff after seeing that. Story 23. Doctor's office, not hospital. I was the receptionist, and a guy came in with what was clearly whooping cough. He kept telling the people with him it wasn't, while in the waiting room. He went back as quick as possible. Doctor said, "We'll call you an ambulance." He declined, wanted to walk out. He collapsed right in front of my reception desk. Luckily, doctor had already called the ambulance and they pulled up very shortly after. Dude exposed an entire family practice to pertussis, including infants. I was an extern, and this was 2017 when I still had a modicum of trust that people weren't this stupid about infectious disease. If that didn't cure me of it, 2020 sure did the trick. ETA. Luckily, this was right before we closed for lunch, and you bet I sanitized everything in that waiting room. Story 24. A nurse told me that my mom was here to see me after I was in for the day for surgery. Surprising, as she lived 80 miles away and I wasn't expecting her. Turned out that it was my friend who'd offered me a ride home. She just lied because she was worried she wouldn't be let in. Story 25. Used to be a frequent patient, so have seen a schizophrenic woman in the ward for several weeks screaming her head off about everything, including the nurses trying to make her wear a pad, etc. Was walking around the ward and saw the moment a woman passed away surrounded by her family. They were spilling out of the room and into the ward and was wheeled out shortly after. Most harrowing was in ER, a man wheeling in his in and out of consciousness wife that honestly looked like she was passing away and slapping her and everything to try keep her awake. Seeing the horror, shock, and pure heartbreak on his face is just stuck in my memory. Story 26. My now late mother and I were in triage in the hospital, had to wait in the hall to be seen. We were seated next to a man that looked like Bill Fagerbacka, actor that was in the movie The Stand, and is the voice actor for Patrick in the SpongeBob SquarePants series. The man looked about 40, and his elderly parents were there with him. Everything was fine and dandy. I was twiddling my thumbs looking down, until I hear a nurse speaking with the man. Nurse: "What did you eat for breakfast today?" Man: "A gallon of lighter fluid and 2 bricks." Nurse: "Okay, and what is your name?" Man: "Bob Marley Mofo." Nurse: Okay, great, I'll be back in a few minutes. I realized I was sitting next to someone who likely had schizophrenia or some type of delusional disorder. It was insane and fascinating how calm and patient the nurse was with him. A few minutes after that, a psychotic woman was being strapped to a bed as she was having a mental break. My mom and I genuinely thought we were accidentally in a psych ward. For years after, Bob Marley Mofo was our little inside joke. Story 27. I was in the ER for reasons, and while in a bed there was another woman next to me who was very obviously there to try and get pain meds like morphine or similar. She would roll around in agony when a nurse or doctor was in the room, but as soon as they left, she'd be snacking or laughing at the TV or calling someone. A few hours in, she gets a phone call and starts freaking out. Says her daughter was stabbed and she needs to go. I knew she was an addict of some kind, but her fear and panic sounded very, very real. She started calling for nurse to come take her IV out because she had to leave ASAP to go to her daughter. She's crying and ripping out her IV by herself. A whole mess. The nurse who is discharging her asks her if her daughter would be taken to that hospital, and the woman says her phone is dead so she doesn't know. She's just going to go to wherever she last heard from her. I still think about her and wonder if her daughter was okay. Or real even. Story 28. I was sat in a Thai emergency room waiting area a few years back, and a guy calmly sat down next to me, holding his hand to his face. Lady he was with went up to queue and fill out the paperwork and whatnot. I politely said hi in broken Thai, he said hi back, and we paid no more attention to each other. She got to the front of the line and the triage nurse ran over to him immediately and spoke urgently and rapidly to him. He responded calmly, stood up, moved his hand, and showed her his eye, which was in his hand, dangling from the socket on a long thing. He and the lady he was with treating the whole situation like a minor inconvenience. Story 29. I once met Michael Jackson. Well, not the actual Michael Jackson. A very nice man in psychosis who was convinced he was Michael Jackson. He wasn't even in the psych unit. He was on a surgical ward after jumping through a large window to escape from Interpol. He had 2 broken legs and severe lacerations. Interesting guy. Story 30. I was recently admitted to hospital. I was at the time pretty okay and only 30. They put me on a ward with 70, 80-year-old dementia patients. It was 30°C, no aircon, and the windows closed because it was winter, and they were old, 2 of them themselves. And one was telling me to wrap the medical cords around my neck and hang myself. I thought I was going insane and discharged myself. Ended up being cancer, so not the smartest choice, but never mind. Story 31. Being told the baby I was pregnant with had no heartbeat from listening with the stethoscope. But because I was admitted through emergency due to heavy bleeding, not the maternity ward, they couldn't get a sonographer to see me for 2 more days to confirm. The nurse then left my husband and I in a room alone for 4 hours without even checking on us, despite the fact I was bleeding heavily and begging them for help. Her words were, "This happens all the time. You'll have another one." The machine was literally upstairs and being used for other women who were admitted via maternity anyway. That baby turns 8 now. So wild how we thought for a day there that he'd died. And again during birth, but that's another story. Needless to say, hospitals aren't my favorite place. Story 32. My surgeon literally yelled at me right after I got out of the recovery room. I had a surgery. He told me I wasted his time and resources, nothing's wrong with me, and my favorite, you really need to consider seeing a therapist about your issue. I now have confirmed endometriosis and suspected adenomyosis. He didn't take any biopsies. Even though that was the whole point of my laparoscopy, didn't look behind my organs, which is also the point, and burned tissue without testing it. Realized after he only scheduled my surgery to prove me wrong also. He dismissed me fully and I kept pushing. He finally agreed but said, "I know you don't have endometriosis while scheduling." Yes, I've reported him. Story 33. I was in the hospital for a few days with what turned out to be nothing, but one night around 3 a.m. they brought a new patient into my room. As they were getting him in the bed, he started having a full-voice conversation about how he felt fine and being in the hospital was silly. In a very polite, calm, but firm voice. He started saying that he didn't need to be there and was going home, getting progressively louder and angrier. I could tell from the voice he was an elderly gentleman, and it turned out he had dementia. The weird part was sitting there in the dark as a larger and larger group of doctors, nurses, and orderlies came to try and get him to calm down. When that didn't work, another woman who was clearly fairly high up the authority ladder started talking in a slow, loud, and clear voice, telling the crowd, not the patient anymore, that they were going to restrain and sedate him. She narrated every step, while he was shouting and threatening. Very clearly, she was talking to future lawyers and investigators. The whole procedure took more than a half hour, while orderlies held him, which was different from restraining him. It ended with something like, "We are injecting him to sedate him," followed by a very quick fade-out before they took him out of the room. It was very sad and scary to see, well, hear, someone who had clearly been a fairly smart, self-assured, and independent person going down that road. Not understanding what was happening and getting insulted and then outraged by what he perceived as his mistreatment and loss of autonomy. It gave me a sense of what it must be caring for a loved one with Alzheimer's. Story 34. A middle-aged woman came into A&E on her birthday with her son, felt very sorry for him, and claimed she'd lost a vibrator up her bum. Had scans and a rectal exam, not by me fortunately, and was telling the history, in front of her poor son, that she was pleasuring herself up the E and had lost the vibrator up there. Turns out there was no vibrator up there and she'd come into A&E to get her bum fingered. When this was revealed, she was sent on her way. What made it more insane for me was that she was telling the staff all this concocted story in front of her son. Lord knows how much therapy he has had to have by now if she did this sort of thing on the regular. Story 35. It was probably before my mum died. She was grossly overweight and heavily disabled, using 2 canes to walk. She was supposed to have district nurse visits and make regular trips to the lymphedema clinic. But between her reluctance to leave the house and her, well, disgustingly racist attitude to the black nurses, nobody would visit. So I ended up being her primary caregiver, while also working full-time. But Mum's sedentary lifestyle caused her health to keep declining. The only time she moved was to go to the toilet or wash in the evening, or to swap between sitting or lying down on the sofa. I made almost all of her food and drinks for her, barring the snacks she would grab on the way back from the kitchen. The bathroom was at the far end of the house. The thing is, both me and my sister, we all lived in the house together, was the one that spotted that Mum wasn't even getting up to get drinks anymore. She used to just grab a coffee or water or bottle of drink from the fridge on her way through the kitchen. But in the last few weeks, she'd stopped doing that and told nobody. We were on heavy watch duty while we were at home. Mum was super proud and didn't admit anything was any different. But we'd noticed she was eating and drinking less, constantly constipated, and spending great durations on the toilet. She refused medical treatment. But one day, after sitting on the loo for quite some time, her foot had fallen asleep. My sister tried to help her up, as this happened a lot, especially now. But she lost her grip, had no power in the leg, fell and broke her toes, while also sitting on her whole leg and wedged under the basin. The ambulance came, took her to hospital, finally, and they assessed her. And this is the most insane part. She was unbelievably unwell. Immense scarring of her liver, a distended stomach, hernias in several places, and cancer that seemed to have spread to numerous organs. They put her on some painkillers, but that transformed Mum. Normally, when out in public, she could at least acceptably feign pleasantries. But the painkillers took off that facade. Now she was spouting all sorts of horrendous things. We kept getting phone calls from the hospital at each change of shift to ask if she was always like this. We had to say yes. Initially, they were polite about it and said that sometimes it happens due to people getting confused by their surroundings or new people when on the drugs. But as the next couple of days passed, they were noticeably frustrated with each update call. After 4 days or so, though, Mum was completely unconscious. The outbursts and thrashing had stopped as she had no strength left. She died after 6 days in hospital. We were only allowed to see her twice due to COVID restrictions at the time. I hate saying this about it all, but it felt like a relief to everybody. She sent a text message to me while she was still awake, basically telling me to take her wallet home with me, but she wrote it half in third person, half in first. I think she meant it as a form of authorization so that if anybody asked, I could show them the text. But her valuables were in a locker anyway. We couldn't take them back that easily. That decline in health over the last month, especially in that last week, was terrifying. It was horrible seeing her be so vile to people like that. Normally, she either internalized it or kept it as abuse to hurl at either me or my sister. All inhibition was gone, and seeing her being like that when these phenomenal nurses and doctors were trying to help was just heartbreaking. It may have been guilt from the whole experience, but I ended up doing charity work for the Children's Hospital that year. I still have the photo they took of me delivering their Christmas presents. It was awful that they couldn't spend time with their families due to COVID. Story 36. The hospital I go to is where police bring people that are in custody, so it's not uncommon for a few officers at a time to accompany someone in cuffs who looks like they've been through a lot. Once there was a young girl who kicked the out of a nurse in her stomach. The scarier instance was when a very large man broke free, still cuffed, and while sprinting down the hallway, body-checking every person in his way into walls, and everyone was just shouting that they didn't know what to do. I was still on a hallway bed, and I could feel the air rush when he passed me. It was kind of crazy. Story 37. I was interning at a hospital, and basically I aided nurses doing menial tasks like making beds, delivering drinks or snacks to patients, and even bathing patients. One day I was helping transport a patient for surgery, and the man seemed fine, chipper even. I didn't ask why he was there, so I just did my job. When we made it the area where he was to be prepped, I stayed because I was curious to see why he was there. The doctor pulled of his blanket to reveal his leg, pretty much soaked in blood with pieces of his flesh loose. He accidentally shotgunned his leg and was taking like a champ. All he said was, "It was my own fault, so I can't be mad. I have no what he was on, but I wish to be that serene if something like that even happens to me." Story 38. Not too insane, but memorable to me. I was in the ER as a patient, and there was another patient who kept leaving his room. I overheard him yelling and carrying on at the nurse station, telling them, "You got me all stuck up with needles like I shoot up crack. I don't shoot up crack, I smoke it." I had to stifle my laughter while the poor, exasperated nurses finally got him to calm down and go back to his room. Story 39. During my time as a patient, I once witnessed a rather unusual incident in the hospital. While waiting in the lobby, a therapy dog accompanied by a miniature therapy pony strolled through, bringing unexpected joy and laughter to everyone. It was a unique and heartwarming moment that added a touch of positivity to the hospital environment, making the experience more memorable amidst the usual medical routines. Story 40. Friend has been a nurse in various units. She's seen a lot of things up butts, been attacked by old people with dementia, and brought people out of comas where they hallucinated and thought the healthcare team were androids, aliens trying to harm them. Also, a lot of body parts have just rotted off of people. Story 41. A 1-1 patient in a hospital was waiting for a bed at inpatient psych. He used a small metal table to break the window on the 4th floor of the building. Story 42. When I was 5, I had my tonsils and adenoids out, shared a hospital room with a little girl who was also supposed to have her tonsils out, became friends in the few hours waiting for surgery, watched prep after surgery. I was back in the room, but she wasn't. She died on the operating table, BC. She had a reaction to the anesthesia and they couldn't save her. Story 43. I was in the waiting room waiting to be seen for what turned out to be gallstones. Not the most fun I've ever had. A group of young dudes come in. One guy's face and knuckles are all covered in blood and his shirt is all ripped up. Obviously been in a fight. The triage nurse asked what happened and the guy's mate says, "He fell down the stairs." The triage nurse was like, "Okay, that clearly didn't happen. I need you to tell me exactly what happened so we can triage and treat you properly." And the guy insists he fell down the stairs. Meanwhile, one of the other mates has picked a fight with security for whatever reason, so the whole group arc up and start trying to fight the security guard, so another security guard shows up, and the whole group, including the dude who fell down the stairs, all get kicked out. Meanwhile, another nurse is getting screamed at by a lady whose son apparently came to the hospital in an ambulance, but there was no record of her son being there. There was some other crazy stuff, but I get the feeling that was just a regular Saturday night.